Hi there, Elmarie again. In this video, I'm going to share with you a bit of an embarrassing experience I've had. And initially I was wondering, should I really include this? But then I realized maybe somebody out there may benefit from this, even if there's one person that needs to hear this. I've shared before that my surgeon is a world-class surgeon and an absolute perfectionist. So when we got to the point of scheduling the date, the theatre date, he said to me beforehand, I need to go to a dentist that he recommended, to an internist, because he wants to ensure that there's no infection, any possibility of infection or rejection of the implant. So I had to go to the dentist and went through that whole process there till he said, great, my mouth is fine and clean. Of course I had to go for various blood tests as well. That came back, everything, all systems go. And then a week before my, if I say first scheduled date, I mean it, my first theatre date, it was a week before my surgeon had to go to the USA. He often goes there for conferences, etc., to keep his skills up to the required level. I had to go to the internist. And I just decided, well, from my very first meeting with my surgeon, he said to me, Elmarie, great, you've got a date now for the theatre. Please just ensure that this right leg of yours remains totally intact. No little marks, no injuries, no nothing. So I was very careful. I was really careful because I waited so long for the surgery. But when I had to go to the internist, okay, now I can smile a little bit about it. To me, it was a devastating experience. I've never felt as stupid and as bad as what I'm going to share with you. So going to my internist, I just thought, I had a look at my legs and I thought, oh, the hair on my legs have grown a bit. I need to shave it. But of course, not considering I couldn't bend this leg because it was tight. It was absolutely stiff, being the cartilage being gone. So I shaved as carefully as possible, but I nipped my right leg in 3 places, tiny little spots, but still. I went to the internist, he checked my heart, my lungs and everything, and that was good, all systems go. I didn't even ask him about these little nips on my leg. But did I doctor them? I sanitized and I put ointment on and I watched them every day and I prayed and I said, please God, in a week's time I need to go for surgery. And my surgeon asked me very clearly beforehand to see to it that this leg, there's nothing on this leg. So I keep putting stuff on and praying and looking, taking photographs, looking at the 3 little nips, tiny little nips, but still they had sort of a red surrounding. At least what I saw is it didn't go any further, but still. So the day comes, my scheduled date for surgery. My friend takes me to the hospital, I check in, they go through all the questionnaires beforehand. I need to put on my little theatre jacket. Now I'm waiting to go to theatre. So they come and fetch me in a wheelchair first and they push me up to theatre. The anaesthetist comes out. Now before I went upstairs, the physiotherapist came around to check on me and showed me what I have to do after surgery and asked if I have any questions. And I said, please, will you just have a look at these 3 little nips and see what you think of that. She looked at it and she got this concerned look on her face and she took a photograph which she sent to the doctor's consulting room, and I suppose they sent it up to him. She said to me, I don't think he's going to operate on you. I know him too well. And I said, oh please, I feel so stupid. And I've been waiting for so long, but she said she's not the one to decide. Okay, so they take me up to theatre. In my little theatre gown and all of it. but in a wheelchair. So the anaesthetist comes out and he goes through the whole spiel and everything and tells me of the implications and am I happy and I'm comfortable, all that. Do I have any questions? You know, so now they have me ready to go into theatre. And I say, yes, doctor, I just have one question. And I sort of lift this little thing that's over me, little gown, theatre gown that I'm wearing. And I say, these 3 little marks. And he says, oh, you know, that feeling, I cannot explain it to you. I felt so bad. So he also takes a photo. And he says, listen, yeah, Elmarie, I can't say anything. The surgeon needs to decide. He says, I'll try my best. I said, please, 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 doctor. I've been waiting for so long. So off he goes. Next minute, they come and fetch me in my wheelchair and take me down to the ward. The surgeon said I must go down to the ward. He'll come and have a look himself. So now I'm lying there. I'm not allowed to change my clothes or anything. I'm waiting. And as the surgeon walked through the door of the ward, he was still in his theatre clothes. As he walked through, I said, please, 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 doctor, don't be cross with me, don't give me. He said, no, I just want to see. So he had a look, and he was standing there for a very long time, and I felt earth just swallowed me. I feel so bad. He just said to me, you could see he was very frustrated. He said to me, why shave your legs? I said, doctor, I'm just so sorry. I really am so sorry. It's a week ago already that it happened, and I tried to nurse it. And he was looking at these 3 little spots, and he said, you know, really, they're small and they don't look too bad, but there's a 1% chance, a 1% chance of infection. I said, yes, doctor, I'm sorry. He said, and I'm not taking that 1% chance. So I'm sending you back home. You know that I fly to the US in a week's time, but we'll phone you with a date. I wanted to, but I agreed with him. I agreed. I said, yes, I mean, it's a major surgery. We can't take that 1% chance, but thank you so much, and I am so sorry. So he left, and I put on my clothes. As I wanted to leave, the sister of the ward came, and she said, no, you can't go home without lunch because you've been lying here for so long. So wait for lunch. So I sit there and I can imagine my face must have looked quite something. The anaesthetist came back wearing his normal clothes just to check, and he said, Elmarie, I tried everything, but yeah, the surgeon has the last say. I said, doctor, thank you. I really feel bad, but thanks for trying. I'm just sitting here waiting now because the sister said I need to wait for lunch. But in any case, long story short, so I posted on my support group, this is what happened. My friend, her name is also Elmarie, immediately responded and she said, do I need to come and fetch you? And I said, yeah, please. But let's go and have coffee, please, at the coffee shop. So they pushed me in a wheelchair to the coffee shop. I waited there for her. When she arrived, she said, Elmarie, your face, I can imagine. I'll show you some of the photographs. And she joked and she chatted to me and lifted my spirits, which I really appreciate. But the main reason behind this video, I don't know what your surgeon is like. As I say, my surgeon is certainly world class. He's strict, but he's kind. Please, before surgery, see to it that you don't have any little marks or scratches or anything anywhere on your body, because we can't take that chance for infection. I hope somebody will benefit from this very embarrassing situation I went through. I can now lightly talk about it, but just sort of lightly. I still feel bad about it. But yes, I've learned plenty in the process. It meant plenty to me because it once again gave me the assurance my surgeon doesn't take any chances, not at all. And I've also learned you can't shave your legs if you can't bend your leg. Okay, we'll talk further on more pleasant experiences. Keep well, ask questions, make comments, suggestions, share your experiences. Have a lovely day and we'll talk again. Bye-bye.